The big issue, the elephant in the room for patients in terms of quality of life these days, is our restricted lifestyle due to the pandemic. So at the CLL Society, we tell patients that even if you're vaccinated, to act as if you're not vaccinated. So for many patients, they're still very much locked down, or when they go out, it's masked and social distancing. And they miss being with their family, they miss being with their friends, they miss going to restaurants, theater, traveling. So the big quality of life issue is to get the world vaccinated, to get that herd immunity, to get vaccines that we know are safe in children so we can protect those and through that protect their parents and their grandparents. This is the biggest issue. The other issue in CLL is to look for potentially curative therapies. Most therapies outside of a very small group of patients who get chemoimmunotherapy frontline and a minority of patients who get allogeneic stem cell transplants are palliative in CLL, which means patients are going from one therapy to another therapy to another therapy. And if we could get some kind of functional cure where we could give patients a therapy that was a finite duration, which seems to be their preference, though overall survival is clearly an important factor in terms of what they're looking for, then the burden of being reminded that you have CLL, the burden of that this therapy is only a step to the next therapy, and constantly having to weigh those things out would be lifted from the patients and would tremendously improve their lifestyle. The third thing, which is related to the first two, is reconstituting the immune system. So even patients who are in very deep remissions with no detectable disease, UMRD, still have impaired immunity and still succumb to infections and second malignancies. So we can knock back the CLL, but if we don't help the patients reconstitute their immune system, they still remain vulnerable to second malignancies and infections. So this is another issue that the clinical community has to address in terms to improve the quality of life of CLL patients.